Hi, everyone, and welcome back to yet another House Call video conference interview. I'm Kevin Kunzman, managing editor of HCP Live, and today I'm joined by my furthest away guest yet, Dr. David Rappaport. Dr. Rappaport is the director of the Sleep Medicine Research Program and professor of pulmonary critical care and sleep medicine at Icahn School of Medicine at Mount Sinai. Dr. Rappaport is actually not with his colleagues right now in New York, but rather is stationed in New Zealand for some supplemental work that came before the crisis had reached the country. And as a result, his travel plans have changed. And Dr. Rappaport, if you want to start off by just saying hi and tell us a little bit about what it's like right now in New Zealand during COVID-19.
Yeah, thank you. Thank you for reaching out. Yeah, I'm very lucky to be in a country which has had an extraordinary response and has a very, very good approach to this crisis that everybody has. And we think we're seeing a response to their early shutdown. They were very aggressive. They have a long history of keeping biohazards out. Fruit and vegetables are a very big thing here, and they have a good system at their borders. But they switched very quickly to try to control the influx of coronavirus. And when they started noticing the first case of community transfer couldn't be traced to somebody coming in with the disease, they clamped down, immediately went from level 2 to level 4 in 2 days. And we've been in pretty much complete shutdown for now almost 2 and a little bit more weeks, planning to do it for another 2 weeks. They've seen their cases go down, and they hope to stamp out the remaining cases. They've had only 2 deaths, both in elderly, one in a nursing home cluster. But they've had a beautiful system, one which I think should be a model for others to copy in terms of the distribution of information by their prime minister, the collaboration of all the levels of both ministerial. The opposition party has joined in and held back from commenting where they might otherwise take advantage of slips, and worked all together. The system is just really working in ways that are quite enviable and quite beautiful. And of course, they have a very nice health system to begin with, where everybody is covered by essentially a national health service of sorts. They have local departments of health which distribute the care. They do have a private system which is overlayered on that, but essentially everybody is covered for the minimum. And they're putting out some very nice efforts right now through that at getting everybody their flu shots, because here, of course, we're entering winter as opposed, we're in fall and entering winter, and so the flu season is upon us, and so they're trying to get everybody vaccinated to try and not add to the burden of the hospitals. Their hospitals are gearing up for what we hope may never happen, which is an overwhelming influx of coronavirus patients. They've had, I think, 1,200 so far in the country, of whom only a small number have been sick and enough to be in intensive care. But overall, I'm very impressed with not only the health part of it, but the collaboration with industry, with sourcing, with supplies, with immigration. Just everything is working in ways that I only wish we could duplicate elsewhere.
Yeah, like you said, it sounds like a very admirable platform that they've developed there, and the idea of it being essentially a non-problem in about 2 weeks is just fascinating and remarkable. And obviously, we talked about bits and pieces and facets of the makeup of our country that doesn't make it a completely replicable model for us, but there is a lot to be learned from it. It certainly seems that they're one of those stand-up.
What is also enviable here, and I don't mean to go off on that, is that the New Zealanders have always considered themselves sort of the link to the outside for the Pacific Islanders. So there are many small countries with extremely limited medical resources on site. Fiji and Samoa are the bigger ones, but then you have Vanuatu and a bunch of small nation states that are on little tiny islands, and their only communication in terms of resources is through New Zealand. And the New Zealanders have always felt that that was part of their obligation to the rest of the members of the Pacific Island community to try and both protect these people and help them out. So with various crises ranging from hurricanes to various other things, they recently had a measles epidemic in some of these islands, and smallpox could potentially sometime flare. what they've done is they've really worked very hard to try and prevent the spread of coronavirus to these people and to think forward to what they will do if it does get in, which it almost certainly at some point might, and what they might do to help. And I think that that's another very laudable thing that they're doing, aside from helping themselves, is to think about helping others.
Certainly, that's admirable, and I think honestly it's something that we see anecdotally in the communities each day, individuals stepping up to bat. And in terms of if it's prevention, then it's prevention. If it's a case where we're already dealing with it, I mean, we can go on a whole thing about what your colleagues are doing here at home right now to try to stop the spread and help those that have been infected. And I was curious actually to that, doctor, if you could tell us a little bit about what the uses and utilization of healthcare personnel looks like in New Zealand right now, a place that has been very focused on prevention and as thus has it more managed.
Well, I'm not actually in a position to tell you very much firsthand. From a distance, I think they have a system, of local hospitals that are working to prepare for the epidemic. Everything is in lockdown, so obviously things are a little different. I think they're working towards telehealth for wherever it's possible, like everybody else. But I'm not aware of any of the details other than that, as I said, they are in lockdown, so everything is kind of modified from their usual, but they have a pretty good infrastructure of available health for most of the population. There are, as everywhere else, disparities, and clearly the Maori population here has much the same place as the indigent population in parts of the parts of the United States and so on, so that they are relatively less able to access the resources, but they're well provided with the National Health Service. There's nobody who's uninsured completely. There are resource problems, obviously, and distribution problems, and they're doing their best to attend to those in this setting. I can't give you much detail about how the actual system is working because I'm not actually in a clinical capacity here. My contacts actually have been much tighter with my colleagues in New York, and as I'm sure your listeners know and your viewers, New York is the epicenter of crisis. At my hospital at Mount Sinai, we currently have close to 2,000 patients, just the one hospital. We have about 300 people in intensive care and about 150 or more intubated, and we've had just catastrophic levels of burden, to which the system is responding extraordinarily well. I mean, my colleagues have been tireless, very, very generous with their own risk and going in and taking care of the patients. They've, I think, kept the mortality remarkably low considering what is known elsewhere. I don't have exact numbers. My own role with my pulmonary and sleep colleagues has been a very small piece of the effort, which is dealing with the ventilator shortage or the perceived and anticipated shortage. And I assume that's what you would like to talk about a little bit later. But I can say that we just had a faculty meeting this morning where a summary by our chairman, Dr. Powell, Charles Powell, who's coordinating multiple efforts, summarized some of the fantastic work that's being done personally by the clinicians, by the researchers who have come up with some real insights into drug therapy that may contribute, developing antibody testing. These are all things that are going on at many places, but specifically at Mount Sinai that we know of. And of course, this effort to try and deal with the ventilator issues because so many patients were anticipated. Luckily, we have not exceeded our ventilator supply in Mount Sinai, but in some of the outlying hospitals and in some of the other areas, I think this will become a problem. So the effort that's being put into doing this, I think, will be able to help other people, even if it is never called upon locally